I think House Bill 71, along with the many other anti-trans bills that we saw in the session this year, create a climate that is unwelcoming. And it creates a culture that says, hey, you don't matter as much. And when I was outside yesterday meeting with 30, 40 people, including students, that's what they told me. They don't feel safe in their own community. They don't feel welcome. They don't feel wanted. But the message I gave them is that you do belong. You are a human being that has every right to live a peaceful and joyful life, and the government has no right to make the decisions about who you want to be and how you want to live your life. And no one should have to experience the disdain from government that they're experiencing.
I think the message it sends, I love that 17% of us are sending this welcoming message, but I think it's gravely concerning that 83% of the government is sending a very, very different message. One that I think has problems on many fronts. First of all, it's a complete disregard of all science and medicine. I mean, they're throwing aside the recommendations of every major medical organization in the country and every doctor in the state who deals with this. It's a statement that we don't care about parental rights. It's a statement that we're more concerned about imposing something. There wasn't a transgender kid in the state or a parent of a transgender kid who wanted this bill. This was not something that was brought by the affected community. This was brought by people who have no dog in the fight, who just want to tell someone else what to do. So that sends a pretty frightening message to the people of Idaho. But I think it sends a very, very disturbing message about how these lives are valued. Because I'll tell you, I met last week with several transgender teenagers and their parents. Every one of these teenagers had made a very serious suicide attempt and had ended up in an inpatient hospital situation because their gender dysphoria was so extreme. They were then put on these puberty suppressors and hormones, which have a 63% effectiveness rate at reducing suicidality. These kids are fine now. They're happy. They're getting good grades. They're excited to go on to college. But their future and their safety entirely depends on access to these medications, which are now being taken away from them by their government. We are endangering these kids' lives. I think this came out to the legislature. This is not news to them. They heard this testimony, and they acted, I think, with reckless disregard as to the effect this is going to have on these kids and families, many of whom are going to be driven out of state or potentially driven to self-harm. We didn't care about banning surgeries. Surgeries aren't even happening in the state. But I think everybody was in agreement with banning surgeries. That really wasn't the issue. Where we pushed and pushed and pushed was to try to get a carve-out to accept those hormones and puberty suppressors, which have been used for decades very safely, very reversibly. And there was a lot of misinformation flying about that. They are safe. They have been used for at least 30 years. And are commonly used for kids who hit early puberty. Senator Wintrow brought that amendment, which they rejected. An amendment was brought by Senator Ruckty to create an exception in cases of suicidality. That was also rejected, strangely with the comment that that would undermine the purpose of the bill, whatever that's supposed to mean. But no, we tried very hard to secure that agreement, and were turned down.